Hi, good afternoon, and welcome to the first episode of Ortho Talk. My name is Brislin, and I'm an orthopedic surgeon with Westfall Orthopedics. I wanted to talk to you today about knee pain, especially when to call the orthopedic surgeon about your knee pain. Most of us will have an episode where we'll twist our knee, fall down, we might even hear a pop. After any knee injury, the best thing to do is take yourself out of the sport, and if you can, rest it, ice it, and start to take an anti-inflammatory. My favorite anti-inflammatory is ibuprofen, typically about 600 milligrams 3 times a day for a week. If you can't take it because you're on a blood thinner or have blood pressure issues, you can always use Tylenol, 1,000 milligrams 3 times a day. I typically recommend you ice the knee down for 2 to 3 days. If you're still having pain, stiffness, inability to move it, well, then's a good time to call me. The most common injuries we see depend on your age. In a lot of our younger kids, especially if they've had an injury in football or soccer or a contact injury, they may have injured a ligament. For a lot of my patients that are middle-aged like me, a lot of that injury can sometimes be an injury to the bone or a contusion. It could be a sprain of a ligament, sometimes the medial collateral ligament, or in some cases, it could represent a tear of the meniscus. When you come to the office, we typically will take an x-ray of your knee, usually take 3 views. After that, you'll meet with me and I'll take a dedicated history and physical to kind of find the problem. Following that, I'll do a physical exam to see what's going on in your knee. The most common findings in patients are usually going to be tenderness along the inside or outside of the knee along something called the joint line, and that could be indicative of a meniscus tear. More often than not, in a lot of my young athletes, we might find that there's some instability in the knee, something called an ACL tear. For the majority of my knee pain patients, some rest, ice, continuing the anti-inflammatory, and some home exercises may be enough. Other options are a cortisone injection, which can be given in the same office visit, and if needed, we'll go ahead and get an MRI. Most knee injuries will get better within 24 to 48 hours, and in some cases it might take up to 3 to 6 weeks for the knee injury to get better. So remember, not all knee injuries are going to require a visit to the doctor. If you've done the things that I recommended and you're still not getting better, then it's time to give me a call.